This is a video of a very dense cataract, and here I've used the miLOOP, which is the new device. It is again a toric implantation, so that is the Callisto Z-align. Just look at the red reflex. If you look at this cataract, you think it's a grade 1 or 2 cataract because the red reflex is so good, but actually it's a grade 4 plus cataract. Because the red reflex is so uniform and good, sometimes it is deceptive. You can't actually make out the density of the cataract. That's the capsular rhexis being done. The miLOOP is a very useful device for complex cataracts. It's made of nitinol loop, and after a hydrodissection, you'll have to loop the device around the nucleus, and once you retract it, it actually cuts even the densest of cataract. Now you can make out the density of the cataract. So I've done the rhexis, hydro. This is the miLOOP. I expand the miLOOP. You can see that's the nitinol wire. As I push on the button, it gets expanded. You'll have to see that this black mark is at the wound. That's very important. Then once you're around the nucleus, then you rotate the device, and you can actually see the posterior aspect of the loop there. Though it's a dense cataract, you can see the reflections. You just pass the midline, and then you use a second instrument to stabilize the nucleus, and then retract so that you're able to cut the nucleus. So this is a very dense cataract. You can see it's a brownish cataract, and I've cut it into 2 segments. Then you rotate the nucleus. You can put in more viscoelastic if you feel the chamber is shallowing. Then you put in the miLOOP again. Bring it, rotate it, bring it to the center, across, slightly across the midline, and again back again. And then you retract it after supporting the nucleus with your chopper, and then you cut it into 4 segments. It reduces your phaco energy by almost 50%. And you can see that the day 1 corneas are very clear. So I'm retracting the loop. And now you can see that I have 4 quadrants. I start the phaco. And usually my phaco parameters are quite high. I use 60 flow rate and 700 vacuum. And you can see the density of the cataract now. When you started off, the red reflex was so good, but it's actually a very dense brown cataract. And these are cases where the miLOOP really helps. And the safety also is quite good because you don't have to go too deep into the nucleus. You don't have to take your chopper too deep, so you're away from the posterior capsule. And the miLOOP itself is very forgiving. We have used it in quite a few cases, and we have never had a PCR. It's only that you need to do a good hydro, rotate the nucleus before you use the miLOOP and the technique. That's the last fragment. So for the last fragment, you can see that I have the chopper over the piece so that it does not fly and hit the endothelium. And then you can put in a little more viscoelastic, reduce your phaco parameters, the flow rate. There's a little bit of the cortex, and I remove the cortex. Of course, in 3D, the visualization is so much better. You can actually make out the depth. But if they have had a 3D projector, then it would have been a different experience. But even on 2D, you can see the clarity and the quality of visualization. That's the Z-align from the Callisto, the overlay. You also have the illumination, the magnification at 7.5%. Illumination is just 18%. So it's very comfortable for the patient when you use a low illumination. It's very comfortable for the patient and for the surgeon.